Welcome back, dear listeners, to the Dish with Dina podcast. Thank you so much for tuning in, or welcome if you have just found us. It is October, and we are bringing awareness to cancer in its many forms, even though you might be most familiar with the pink ribbon that signifies breast cancer. This is going to be a solo episode in audio only because we just wrapped a whole webinar on this topic that will eventually be uploaded to the Wellness Webinars playlist on the Dish with Dina YouTube channel. But I thought I'd share some key information and takeaways here in the meantime. So sit back, enjoy the conversation, and let's dish. October is probably best known as Breast Cancer Awareness Month, and the pink ribbon is the catalyst for today's topic. But as I mentioned in the intro, I wanted to share some more information that reflects other types of cancers and their treatments and their awareness months. And so when you're looking at, statistically speaking, what we have going on right now across America and across the world, there are about 50 plus common cancer types and different diagnoses and different months that are traditionally set aside for those groups. Some of them that you might have come across, or in case you see these in the future, you'll keep an eye out for them. We have dark blue, which indicates colon cancer, and that awareness month is in March. We have ovarian cancer, which has the teal colored ribbon, and that is usually shared in September. Bone cancer is yellow, and that awareness month is in July. And then we have skin cancer, which is black colored ribbon, and that is the awareness month for that is in May. But as I'm looking at the list in front of me, which unfortunately is far too long for me to read here, things like bladder cancer and gynecological cancers and lung cancer, and the list goes on and on. So let's first talk a little bit about what even is cancer. That feels a little bit scary. When our cells grow and multiply and become old, they split off and they die, and then new cells take their place. The issue with cancer is that we have these abnormal or damaged cells that grow and multiply when they shouldn't necessarily be doing so. So that grows out of control. There's no guidance listed through your what's known as your DNA. And almost like a car that speeds up without being able to hit the brakes, those things can also get out of control. When those cells grow, divide, multiply, etc., they may form tumors, which are just masses of tissue. They are known as malignant tumors when they become cancerous, and if they happen to invade or spread into nearby tissues, travel to different places in the body to form new tumors, that is known as metastasis. So you might have heard of a cancer that has metastasized to a different part of the body. Benign tumors are not cancerous. They do not spread. They do not invade nearby tissues, but sometimes they can grow to be a quite large size. And so if that is the case, they could cause some serious symptoms or damage to other areas that they're growing into. Like if you had a benign tumor in the brain, they can be quite life-threatening in itself, even if it's not cancerous. And that might require some surgical removing of that particular lump or mass of tissues. It is predicted in 2025 that there is an estimated 2 million new cancer cases and over 600,000 cancer deaths to occur across the United States, with some of the more common cancers being skin, liver, colorectal, and lung. A lot of the risk factors could be considered modifiable, which means you have the ability to change it. But as we always say on this show, it's not always the individual's ability or responsibility to be able to have healthy outcomes. So if you are an alcohol drinker or a tobacco smoker or user, those particular items are known to be what the word is called carcinogenic. So that means that they are known to be cancer causing. And according to research, they are classified as quite high on that list. So I always say, how much is too much of anything? If you have one glass of wine, is that going to immediately damage your cells? If you have one cigarette, is that going to immediately damage your cells? Not necessarily, but again, it depends on environmental factors and other factors in your life, whether it's genetics, whether you have had exposure to different kinds of viruses like the human papilloma virus or Epstein-Barr virus as well. Those things can put us at more risk for common cancers because they end up damaging or reducing our body's ability to fight infection, and they end up hurting our immune system. So thank goodness, we have some ways around this. We have things like vaccinations to help protect against some of these viruses. Hopefully, if you know what your lineage, just because somebody else in your family might have gotten cancer, yes, that puts you at risk for it, but doesn't necessarily mean that you are also going to get that. Again, it depends on your specific or individual situation. And we also have issues around other diseases and conditions as well. Again, when we're under a state of constant inflammation or fighting infection, our bodies can end up becoming a little bit compromised, and immune compromisation can lead to other issues, and then metabolic issues happen too. But really, we're talking about the cellular level and our DNA. So sometimes a cancer diagnosis might come out of the blue with no symptoms at all, but more often, there could be some symptoms that are considered warning signs of this disease. So I don't want to freak anybody out. I just want to encourage you to pay attention to your body. Take a look, take a feel, see what's been going on. Make note of some things as well. If you're noticing some patterns or symptoms, jot those down so you can bring that information with you to your doctor. If you have significant or severe changes in weight, and we're talking unexplained weight, so a percentage of your body weight over a short amount of time where you feel like, that's curious, I wonder why that's happening. Either that could be fluid buildup or there is some sort of deterioration happening in your body. That's an indication that you might need to get yourself to a doctor and find out what the root cause of that is. Other things that sometimes come and go that are part of our everyday natural occurrences, nothing to be too worried about. But again, if you see patterns of these things happening, like extreme fatigue, unexplained fevers, persistent pain in certain areas, but then they also spread to other areas and they don't really go away, you're not really sure where it's coming from. Any skin changes, signs of yellowing in your eyes or your fingertips, if you have moles or spots on your body that are changing borders, edges, color, growing in size, again, that can be a sign of a skin condition that you can check with your doctor or your dermatologist for that. Shortness of breath, unexplained bleeding. So if you're coughing up spots of blood, if you have abnormal bleeding vaginally, if you are already past the age or into your menopause years, if you see blood in your urine, bloody nipple discharge, or bloody stools, again, maybe it's something not to worry about, but if you're noticing it happens quite often, then please make sure you're getting checked at the doctor. And of course, any lumps or masses over your body too. So I always say, if you're taking a shower or just doing kind of like a little patrol across your body, that's always a good way just to see what might happen from week to week or month to month if you're noticing any changes or signs and symptoms that are occurring. If and when you get diagnosed with cancer, that is something that happens over a few different kinds of tests. So there's no single test that's going to tell you that. Instead, your doctor might provide you with some blood tests or other lab tests like urine or bodily fluids. So those things might rule in or out one particular issue and or might give your doctor more information to figure out if we need to proceed to the next level, like we're going into imaging or biopsies. So we're talking about things like a CT scan or an MRI scan or a bone scan or an ultrasound. And a biopsy would be where there is a segment of tissue that is taken from that particular area, whether it's a tumor or a sample of abnormal tissue. And then the doctor will be able to test that out and find out what's going on. Then again, you're getting ruled out or ruled in depending on what the doctor is seeing. When it comes to treatments, there's also a combination of those as well. Anybody who has been diagnosed with, depending on the type of cancer, depending on the stage that they are in, your doctor might provide you with a list of options, whether it is chemotherapy, so that's going to help with stopping or killing the growth of cancer cells, and other fast-growing cells around the area. They might provide you with radiation options too, which is a high dose that also will kill cancer cells and shrink tumors. Because so much of that is going on where other parts of your body or other cells in your body might be at risk for getting killed off, even if they're not cancerous, they might also talk about something known as immunotherapy. So that can help with your building up your system and providing you back with some stronger cells to help you fight and recover from your treatments. And of course, surgery, like I said before, there's going to be a biopsy to get it originally tested out, but more often than not, you're going to have that lump removed, and then there will be targeted therapy for them. So one of the things that I'd like to always share when I do my webinars or conversations around things like this, conditions and what to know when you're going to your doctor, is questions to ask, empower you to understand a little bit more, whether it's you personally or someone that you're going with or somebody that you know is in your life, of just understanding what to ask. So some of the things that you might want to consider are, what are the treatments for my type and stage of cancer? What does that indicate? Is it a combination of those therapies, as I just gave the list before? What are the benefits and risks of each of these treatments? Knowing ahead of time if you're going to be very fatigued, if there's going to be any changes in skin or taste or smell conditions, just to be aware of that. Is my hair going to be falling out in clumps? Just to be aware of those things so you know what's coming. Will I need to be hospitalized or be sent to a particular treatment clinic? And if so, how long? How often is that going to happen? Because you might have to take time off. You might have to arrange for childcare, or maybe there are certain things in your health insurance that stipulates certain amounts of sessions are covered, and then beyond that, it is going to be out of pocket. So that's going to be something you should check on as well. What are your chances of recovery? Because all of those also have statistics with them too when you're talking about cancer treatments. And how do you evaluate? How do you monitor that the treatment is working? Is there going to be some blood test that goes on there? Am I coming back every 3 months just check in? And will this eventually go into remission? So here in my world, where we have registered dietitian nutritionists, we also have subspecialty dietitians known as oncology dietitians. They work within cancer treatment centers or teams to help assess a patient's nutritional status. They help create personalized meal plans to manage any side effects like nausea or appetite loss, which is quite common, and supporting recovery too. So helping patients heal through the process, and or if they need to, if there is significant damage or it is an extreme case, then they might help with providing tube feeding or supplements if food is not, whole foods and food items are not an option for that particular patient, even if it's for a short term. A few things that I shared in the webinar too, which I just want to address here as well, are some myths and misinformation. A lot of times you might hear something like sugar feeds cancer, or don't eat fruit because it's going to cause damage. And there is no evidence about that. I think what ends up happening is that people understand that tumors or cells grow through nutrients, and a lot of times people vilify sugar or carbohydrates. So yes, it's helpful to limit or reduce your intake of added sugars, but you're not cutting out carbs entirely, and cutting off sugar to quote unquote starve your cancer is not going to work. The evidence doesn't say that there is a link between starving yourself of it will reduce your risk of cancer or stop the cancer from growing. So the answer to that is absolutely not. Please make sure that you're still following a moderate amount or having a well, diverse, balanced diet that's going to help support your overall health. The second thing is organic food. So people oftentimes will say, quote unquote, I need to eat clean because I'm dealing with a cancer diagnosis, and they go through the organic foods instead of the conventional foods. Now, we all know those are usually a little bit more expensive, but there is some indication or some correlation that the study, I think from 2018 that I'm looking at here, that adults who most frequently consumed organic produce, dairy products, etc., did have 25% fewer cancers compared to other adults who never ate organic foods. But I do feel like those conditions, those factors when it comes to those scientific studies are quite limited. So we don't know what else is going on in that world. We don't know if the person who isn't eating organic food is living with financial issues and or in a particular community that doesn't lend itself well as far as environmental toxins are concerned. So they could be having other factors that can potentially put them more at risk for cancer. So in that particular study, the researchers did not test pesticide residue levels. It's a very hard thing to do. A lot of times they'll say it's just notoriously difficult to be able to capture all of the things involved in this. And as I said, I feel like it's a little bit of an elitist approach to being like, hey, if you can afford organic foods, you're not going to get cancer. And if you can't afford organic foods, then you're more at risk for it. In a perfect world, we'd all be able to afford all of the things that are high quality, nutritionally dense for us. The third item on that list had to do with these quote unquote superfoods, again, along those lines of that marketing term of clean eating, and superfoods can cure cancer. Not true. I mean, there are foods that are high and rich in those chemical compounds that are known as antioxidants, and also fiber containing foods too, or healthy fatty acids, which can help with reducing our risk for all types of chronic conditions. But there is no official definition of what a superfood is. If you've attended some of my webinars listeners or listened to some of my podcasts in the past, you know that some of these are just marketing terms that don't necessarily have an official definition. But I believe what people are talking about are those richly, densely colored, high in antioxidant food properties, but they don't cure. Nothing will cure your cancer. They might reduce your risk of getting that, but again, it goes along the lines of all the other factors that you have to take into account when you're talking about your health in general. Now, let's revisit this conversation. This comes up a lot in our discussions, the social determinants of health. We're talking about housing, food access, education, healthcare access as well. Some examples that I've come across in some of the research I was doing for this discussion was that higher colorectal cancer mortality, so the death rates of that, do tend to happen in more marginalized groups, underserved populations, because there are some screening disparities. There's some, again, lack of education, lack of healthcare access among those groups. So that could be the correlation there that I want us to be aware of. Just because somebody is in a particular region, they might not have access to something and they want to do everything they can to reduce their risk of cancer or other chronic conditions, but there are systemic inequities set up against them, whether it be lack of community programs, educational outreach, policy, etc. I will direct you to the webinar when it's posted up on the YouTube channel. I think probably about December, I believe, of 2025. You can find that in the Wellness Webinars playlist. So you can find out exactly, more specifically, the screenings and early detection information I'm going to share with you here. But really, anywhere between the ages of 20 and 80, say, you will probably be going to get physical exams, and you probably should inquire with your healthcare provider about what screening tests you should be aware of. Some of them will come naturally, like sometimes doctors will just automatically recommend a mammogram after a certain age, or if you are showing signs of being at risk for something, whether it's through genetic, family history, or you have been a smoker for a really long time, you might be more at risk for things like cervical cancer, colon cancer, lung cancer, etc. I will stop here just to point out one specific cancer type, which is prostate cancer testing and screening. Men are more likely to either downplay their symptoms or not go and get tested or go to their doctors regularly. We have a whole different discussion about men's health awareness. I believe that's in one of the podcast episodes, which I could probably link here, and also on the YouTube channel. If you have a man in your life who is a little bit stubborn for going to the doctor, or if you are that man that needs to be a little bit more conscientious of their health. So usually starting at the age of 45, men who are at higher than average risk of prostate cancer should talk with their doctors about getting screened, getting tested. And of course, there could be some risks and benefits involved in that too. So deciding what is best for you if you are at higher risk. Please make sure that you're checking with your doctor and get a second opinion too if you're a little bit concerned about what your doctor is requiring for you to do. I will say on my end, we have breast cancer that is running through my dad's side of the family. And so we've had some breast cancer diagnoses and some deaths because of breast cancer. And in my story, I do go for my mammogram on a regular basis. I also have been told by my doctor and the imaging centers that I'm considered high risk for my age, dense breast tissue, and family lineage. And so I'm always like, sure, I'll go. Whatever I need to do to make sure that I'm catching something early if that becomes the case. But unfortunately, my last imaging was not covered by insurance. And I had asked all the questions ahead of time. And unfortunately, they can't really give you some itemized information at that point. And so I just did it anyway. I went to it. I didn't owe anything at the time of the imaging, but about a month and a half later, I did get a bill for about $350, which honestly is probably less than what the actual cost was. So there was some coverage from my insurance, but my insurance did a while back send me a letter that said they do not deem my imaging or my further testing as medically necessary. So this is a personal choice that I made. And if you have the ability to do so, a personal choice that you can make as well, just to make sure that you are keeping on top of things. I would rather be safe than sorry. I don't mind getting tested every so often. Obviously, as things continue to be clearer and as I get older, my risk won't be as high. And so I could probably come off of having to go so frequently. Now, our general recommendations are no different than anything else when it comes to reducing your risk of any condition, and cancer is in that category as well. Stay away from tobacco. I am a former smoker. I have talked about this a lot of times before in my podcast and other things that I've done, webinars, etc. I'm very open and honest about it. It took me a really long time to quit. Well, it took me 4 years. I don't know if that's really a long time, but I was smoking for 23 years. It is a known carcinogen. It is also quite addictive. People aren't always successful. I had to go through many different things. I had to, thank goodness, I reached out to my Department of Health in New York City, and they provided me with a tobacco cessation program, and I was able to get free products like gum, nicotine gum, and the patches. And I had a counselor who also walked me through some triggers and really did such a great job in detaching me from having to use that as a habit. But also, secondhand smoke plays a huge role in here too. So be careful of what you're around, your environment. If you live with somebody who smokes, see if you can get them to step outside or get an air filter or something that just decreases your risk of breathing that stuff in. It's not great. Cutting back on alcohol. I know I'm never anybody's favorite person when I talk about this because people like to drink and enjoy socializing and happy hours. But the current guidance is that if you drink, do so in moderation. And if you don't drink, don't start. So really, really take a look at your alcohol intake and try not to just save it all up for a weekend or an event because it is a known carcinogen. And again, the threshold of what your body can take. Every 24 hours, we go through metabolizing and excreting and, and digesting and processing things. So don't put that stress on your body. If you are drinking, the specific recommendations in this case is no more than one drink a day. A drink is defined as a 12-ounce bottle of beer, a 5-ounce glass of wine, or a 1.5-ounce a jigger, a shot glass of 80 proof distilled spirits. So liquor, I guess, would be the thing. I'm not a drinker, so I don't know. I don't know what I'm talking about with this stuff, but if you are a drinker, you would know. Okay, maintaining overall health, right? So I really try to be conscientious and sensitive when it comes to discussing weight and body weight. And I will say the emphasis always tends to be on somebody who is on the higher end of weight, the larger size bodies, but risk factors can also affect people who are on the lower end of things. It really has to do with body fat, excess or lack of a percentage of your overall body fat. So you won't know that by stepping on a scale. You would know that if you have a handheld fat monitor, or maybe if you have a smart scale that can give you some information, or at your doctor's office, you might have calipers that can tell you what the body fat percentage is there. The issue is about being in a constant state of inflammation. So if your body is undergoing quite a lot of external factors or struggling to keep up or has a lot of abnormal blood tests, that might be a time to check and see if you are managing and maintaining a healthy weight. And I will also define this as what you've been through your whole life that feels comfortable for you. Okay, not everybody who's in a smaller body is going to be automatically healthy. Not everybody who's in a larger body is going to be automatically unhealthy. So just being conscientious and not going up and down and up and down. If you can move what you can, be physically active as often as you can. The guidance here is about 30 minutes a day, 5 days a week. So however you can increase your cardiorespiratory functions, as long as you're medically cleared to do so, move in a way that you enjoy, take some bursts because that adds up too. If you can't get 30 minutes in a row, then do 10 minutes every so often. Just don't try your best not to be sedentary. If you have physical limitations or immobility issues, then please speak with your doctor or therapist, your physical therapist, to make sure that they're providing you with exercises that you can do that are modified to assist you in a way that, again, you can get that blood and oxygen flowing. Eat well. I mean, we talk about this all the time. I also, as I said before, I realize that might be out of everybody's control, whether you have access to healthy, affordable foods or time constraints play a huge role in this too. So make the good choices. If you can, go back into some of my past episodes or webinars on the YouTube channel and take a look at some of the meal planning things that we have there, eating on a budget, etc. The goal here is really to try to balance out your diet, try to include a diverse, balanced diet. Eat as much as you possibly can from a variety of different food groups and put those things on rotation. Plenty of produce items, whole grains, limiting and avoiding anything that's considered highly processed, whether it's meats or cured items like bacon and, all the fun things. Extra added sugar, extra saturated fat, high amounts of salt intake, sodium, etc. And I will say too that your social circle plays a role. Anybody who's dealing with a cancer diagnosis, or if you are helping someone out who has been diagnosed with cancer, you're their caregiver or their friend or family member or a coworker who's just very concerned, a lot of times there's going to be fatigue, pain, and potential financial issues coming up for that person. So help them out. Maybe make some food, drop stuff off at their house. Maybe bring movies over. I don't know. Do people bring movies over anymore? Sit down and do a streaming service together and just enjoy. Try to get them to engage in some fun activity or whatever their energy level can take in, because those diagnoses obviously can be quite overwhelming, quite scary, and cause a lot of physical and mental stress and anguish on that person. I'm going to link to a bunch of different cancer-specific resources and organizations if you want to learn any more about this, because I only have so much to give. I don't specialize in cancer, but prevention of is easier said than done. The treatment and the recovery period is much more specialized depending on, again, your type of cancer or your stage of diagnosis. So please make sure that you work with a team, reach out to people who can help support you, and hopefully you'll be on that path to health before you know it. Thank you so much for joining me this week on the Dish with Dina podcast. I am Dina D'Alessandro, registered dietitian, nutritionist, founder, and chief executive life changer at Dish with Dina, and I'm also your host. If you like what you heard, I would be so grateful if you could subscribe to this podcast, leave a review, and share this with others who you think might benefit from what we have to offer on these episodes. You can also join my mailing list at DishWithDina.com or email me at info@DishWithDina.com with questions, comments, feedback, and if you'd like to be a guest on a future episode, because everybody eats and we all have a story to share. I hope you tune back in next week when we dish again.